In OME, resonance measures and articulation measures were used to assess the integrity and function of JD's VP port. Articulation measures included the GIFTA, where a severe articulation disorder was documented. High-pressure oral consonants B, P, K, T, and G were either distorted or substituted with a glottal stop. However, he did have present P in word final position and D across all word positions, indicating an ability to build up interoral pressure, which implies that there is an intact VP structure and function. Serial counting and consonant vowel syllable production indicated nasal emissions through the use of a small mirror under JD's nose of s, sh, and sh. Phonetic inventory and stimulability testing showed that JD was stimulable for productions of S without nasal emissions and was also stimulable for stomp consonants. Resonance measures included consonant vowel syllable production, where mild hypernasality was noted in the production of high front vowels. Additionally, the ZOO passage was conducted where JD's nasal scores were measured via nasometer and indicated mild nasality scores as well, where a high nasality score is 30 and an average nasality score is 15, and JD had a score of 23. JD's OME assessment was within normal limits. However, facial characteristics of FAS were noted, with small eyes, short and upturned nose, and smooth philtrum. Due to the presence of nasal emissions and mild hypernasality during high front vowel productions, there may be a structural insufficiency in JD's pharyngeal tissue, which is needed for balanced productions. However, given that JD is able to demonstrate adequate VP closure required to create sufficient intraoral pressure in productions of D and P, we suspect that he has intact structures with the presence of maladapted articulation patterns, as he produced many stop patterns with a backed place of articulation, and additionally had poor directed airflow for fricatives and vowels. We recommend a referral to the craniofacial team for the imaging of his VP function due to the presence of nasal emissions, as well as speech therapy to correct the articulation placement and oral airflow of vowels and fricatives.